Thanks, Julia, and thanks to John and to Katia, and greetings from New York on this beautiful autumnal morning. I'm delighted to welcome you on behalf of UNFPA to this expert group meeting for the 58th Commission on Population and Development, which, as others have said, is on the theme ensuring healthy lives and promoting well-being for all at all ages. First, let me express my gratitude to John and our colleagues from the UN POP Division for our valued partners and partnership in bringing population and development issues to the fore of the global development agenda. And we look forward to continued collaboration on the road to the 58th Commission. As you all hopefully know, back in 1994 in Cairo, the Programme of Action of the International Conference on Population and Development provided an integrated framework for placing human rights, health and dignity at the centre of sustainable development. Since then, the UN Commission on Population and Development has been the main intergovernmental mechanism with a mandate, as John said, to monitor, review and assess the implementation of the ICPD Programme of Action. This expert group meeting is timely. It follows the Summit of the Future held here in New York just 3 weeks ago, where the Pact for the Future was adopted, and it's ahead of the 2025 High-Level Political Forum review of SDG 3 on health and well-being. As we know, the Pact for the Future had little emphasis on health. So this meeting and its contribution to the deliberations of the 58th CPD provides a critical opportunity to emphasise the importance of investments in health throughout the life course, not least to enable everyone everywhere to achieve long, healthy and fulfilling lives. In the 30 years since Cairo, as John and Katia said, significant progress has been realised across various goals of the ICPD agenda, including greater longevity and decreases in maternal and newborn mortality rates. Access to HIV treatment has averted millions of deaths, and yet progress has been uneven. And in some cases, such as for maternal mortality, progress has recently stalled and even reversed. Across health indicators, challenges to progress have been exacerbated by increasing inequalities, environmental degradation, food insecurity, and a growing number of crises and emergencies. It is clear that we're living in a rapidly changing world with a few key trends that we need to consider as part of our deliberations over the next 2 days. We know that over the next 30 years, the diverse demographic patterns and trends that we're witnessing within and between countries will continue. Sub-Saharan Africa and South Asia will be characterized by young, rapidly growing populations, calling for governments to anticipate and prepare for a growing demand for comprehensive sexual and reproductive health services. We know that where population growth is most rapid, health systems remain fragile, with inadequate financing, infrastructure, and health workforces. Urbanisation and overcrowding pose significant threats, especially during pandemics, and demand new modes of healthcare delivery to ensure we address the growing inequalities and leave no one behind. Countries elsewhere can foresee large increases in the numbers of older persons and will need to adapt health and social care systems, including in relation to health financing, the health workforce, and the balance of health services being offered. Our discussions here today and tomorrow on the life course approach will be critical to take these evolving needs into consideration. And climate change related impacts such as extreme weather events and changing disease patterns pose multiple potential health threats, including reduced access to life-saving maternal and newborn healthcare, as well as other health services. Nearly all forecasts predict the climate crisis will increase the scale of populations on the move, and greater human mobility will further test the resilience of health systems and the universality of health insurance schemes. As we discuss the importance of realising the aspiration of universal health coverage, let's remind ourselves that gender inequality, socioeconomic disparities, and unequal access to healthcare services contribute to inequality in health outcomes. Addressing these disparities, as well as meeting evolving health needs such as mental health, require careful attention to the principles of universality, equity, and gender equality, as policies are designed to ensure that no one is left behind, including scrutiny on who is being pushed out and marginalised by the design of those policies and programmes. The scale and reach of digital knowledge and digital transformation encourages and enables new modes of care, including self-care, remote diagnosis, and remote treatment. With more powerful health and population data systems, more diverse data sources can be integrated to track the health impacts of new trends and to strengthen health and population forecasting. It is then our task to provide propositions and responses to these global challenges and to reap the opportunities to continue to advance the implementation of the ICDB Programme of Action. To inform the deliberations of the upcoming Commission, UNFPA is partnering with the UN POP Division and will be responsible for producing 2 of the Secretary General's reports, looking at the successes and challenges of policies and programmes related to health and at the resource flows for the ICPD Programme of Action. So I wish you all a successful expert group meeting for the 58th Commission and look forward to hearing the deliberations of your outcomes over the next couple of days. Let us work together to ensure that the conversations are fruitful and goal-orientated so that we can inform the Commission's deliberations with evidence-based and rights-based solutions and continue to affirm the centrality of health in the global sustainable development agenda. Thank you.